Hello and welcome to the Morning Market Call. I'm Greg Lee. Joining me today, Charles Cachoeira. Welcome to the show.
Thank you, Craig. It's a pleasure to be here talking to you.
Now, we've been talking all week about healthcare reform, and we wanted to ask your opinions, your thoughts. Charles is actually Dr. Cachoeira, a licensed and practicing Brazilian doctor. So what changes would occur in the medical profession? Actually, let's start off with an overview of the medical profession.
Okay, perfect. The healthcare industry here in the USA is the largest industry. It employs around 60 million jobs here in this nation. It's really a fast-growing industry. It's forecasted to increase 25% in the next 10 years. Among the 20 fastest,
the fastest growing. Keep going. Yeah, we're good.
The fastest growing occupations, healthcare has the 10 fastest positions.
Okay, now it sounds like those of us who are working on our MBAs right now are actually going into the wrong profession. We should be going into medical. How do you get into the medical profession now?
Perfect. Most of the occupations in healthcare system, it requires less than 4 years of college education.
Okay.
But if you want to work diagnosing or treating patients, you need a high education, 6 or more years of college education.
Sure. So licensed and trained doctors,
yes.
Nurses. Okay. Now, within the industry, who are the biggest employers?
Okay, 75% of all these jobs, they are found in offices of physicians or dentists or healthcare practitioners. And although the hospitals, they contribute with 1% of the establishments, they employ 35% of all these employees.
Wow, okay. So I guess because they have just a lot of employees,
yes.
in each hospital. Okay, that makes sense. So what about Brazil? Brazil has a very established medical industry also. Okay,
in Brazil it's interesting. We have both systems. We have the public healthcare and we have the private healthcare. So all Brazilians have the right to receive health assistance. If you have conditions, financial condition, you can purchase a private healthcare. If you don't, at least you have a public coverage.
Sure, okay. So those are what everyone's calling in the U.S. right now the Cadillac health plans, the private healthcare.
Correct.
All right, so what would actually change, going back to that question I asked earlier, what would change with the medical profession if healthcare reform is passed?
Okay, for the first time, the American Medical Association, they have been pushing this healthcare reform.
Okay.
They say that they cannot support these status quo. There are 45 million Americans that are not covered. They don't have health assistance, and they need right now.
Sure.
And among all the groups, they'll gain any benefit for this healthcare reform. The physicians is the most who gain financially.
Now, wait a second. So physicians are going to gain a lot, but what we've been hearing is they're going to cut costs everywhere. So how is it the physicians are missing out on the cost cutting?
Okay, so they were really strong in their lobby. They lobbied really well, so the salary won't be cut.
Okay.
And there will be many more customers in the market to be treated.
Sure, 45 million more.
Yes.
Okay. And then you were talking earlier about growth within the medical industry. We're going to need more doctors soon also, right?
Yes, that's a big problem. The U.S. Department of Health, they said there will be a shortage of 35% of physicians in the next 10 years. And if the healthcare reform passes, this number will increase a lot.
Okay.
And the same applied for the nursing as well.
Okay, so let's change gears real quick and let's go to the pharmaceutical industry.
Okay.
What's going to happen in the pharmaceutical industry if healthcare reform passes?
Okay, we don't know exactly how the healthcare reform will be, but for sure they will affect the pharmaceutical industry.
Okay.
They'll have to cut their costs in $8 billion, and they'll have a higher tax on them. Usually the pharmaceutical industry, their main target is the older population.
Right.
But now with these 45 more million people in the market, they'll have to change their target, especially the young population.
Okay. So they'll actually be, rather than just focusing on older patients, they'll be focusing on everyone now.
That's true. And the young population, they deal different with physicians and with healthcare system. So the pharmaceutical company, they'll have to be creative in their marketing mix.
Interesting. Okay, so it sounds like a lot of the cost cutting will have to come from pharmaceuticals. Hopefully they can still afford the R&D and everything. There's still lots of diseases we have to cure. Hopefully we can do so soon. But thank you so much, Charles, for joining us on the show today.
Okay, thank you, Greg, for this opportunity. It was my pleasure.
And thank you, viewers, for joining us. We'll see you next time on the Morning Market Call.
The Market Call is a production of the Marriott School of Management at Brigham Young University and is made possible by generous donations from Larry Kashjan and Gary Williams. This webcast was produced by Greg Lee, Tim Hark, Julie Kellett, and Jonathan Marucci.